she needs to lose a few. So I had to figure out who was feeding her extra because she goes across the property to grandma's house and gets an extra meal, maybe two, sometimes two a day, I think. So I had to tell grandma to stop feeding the dog. And I'm the only one allowed to offer her food so I can control what's going in her mouth. And boom, within 3 days, her waist reappeared. I'm not kidding you. And you know what? Getting her off kibble is key. I feed my dogs Sundays, which is, they sponsor this podcast on occasion, and they are an amazing dog food company. They air dry their food. It's so great. It's the consistency of a dried food, but it's not, it's raw and it's not cooked. And kibble is just such a atrocious thing to feed your animal. It really is. I'm not judging anyone. I fed my dogs kibble forever, but when I got her off kibble and onto Sundays, her knee pain significantly improved and her waist reappeared. This was months ago. And then just recently, I know she was getting kibble at grandma's house. So got her off the kibble, got her off the snacks, got her off all that junk, and just controlling what goes in her mouth, giving her lots of raw food, dehydrated liver, dehydrated heart, some cod liver oil, making her just a really nice, healthy gruel. And that's mostly raw or dehydrated. And her waist reappeared within 3 days. So that's what grains are doing to you. So again, on my cereal rant and how I think cereal is human kibble, this is why. If you're eating a bunch of cereal, you're eating a bunch of ultra refined carbohydrates, even if it's paleo or keto cereal or whatever I just don't buy into any of that nonsense at all. And you're eating refined grains that have been processed at high heats to put it into some little pellet form. Like, why are we eating pellet food? Like, nobody should be eating pellet food. Anyway, I'm not going to go on a rant again. I tend to go on a rant about this because the whole Fruit Loops thing. But anyway, assessing obesity in a dog. Let's talk about it. Physical indicators, rib palpation. Ribs should be easily felt but not visible. And when I said visible before, I corrected myself. I mean, we should be able to see a bit of a shadow where the ribs are, if you will, meaning we know that's where they are. It looks a bit different than the skin, say, in the chest area or in the rear area. There's definitely some bones underneath, if you will. I don't know how to describe this. It's something I can see really well because I'm a chiropractor. But anyway, they should be easily palpable. Difficulty feeling ribs without pressing indicates excess fat. This is an indication of obesity in your dog. Abdominal tuck, that's their waist. The abdomen should slope upward behind the ribs when viewed from the side. So when you look at them from the side, they should have that, they've got that nice barrel chest where their ribs are, and it should come up. And they've got that tuck that's right there, like right as it joins into their leg, their waist, if you will, right where their hip crease is, there should be a tuck. My dog sometimes gets a big saggy belly there, and that's not a good sign, right? Waistline, there should be a visible narrowing at the waist when viewed from above. So when I look down on my dog, she's standing there, she should have a waist. We should have a waist as well. And about the waist circumference I always talk about. I think, we could do waist to hip ratio. I just think waist circumference period is really a very sensitive marker. If folks have elevated blood pressure, they have a waist circumference that's too high. That would be 35 inches for a female. That's the red flag zone. It should be well below that, in my opinion. Or they have a waist as a male of 40 inches. These are in inches. We have a problem. And if they're not strength training regularly as well, I just pretty much can assume they have metabolic compromise. But I have a free guide called Assess Your Metabolic Health. I'll put it in the show notes. You guys can get it also on my website at drtina.com, and just click the red button at the top and it'll drop you down to be able to opt in and grab the Assess Your Metabolic Health Guide. It is the international guidelines. I've had this up for years. It's a great tool. Print it off, take it to your doctor. It's the international guidelines for metabolic syndrome. It is not meant to diagnose or treat anything. It's just educational purposes, but I want you to have it so you can print it and take it to your doctor and have a conversation with your doctor about it. And then fat pads. We have fat pads all throughout our body. Excess fat over the back, base of the tail, or around the chest may indicate obesity. In a human, I start to look for wings under here, right where your lats would be. Men, especially when they start to accumulate fat there, sort of around the scapula area, that is an indication actually of heart disease as well, or risk of heart disease, I should say. Concern about that. We'll start to get love handles. We'll get a belly. You know the drill, right?